So Dr. Giancaterino and myself, we're both curriculum and instruction developers and assistant professors at Chamberlain University, and we would like to highlight a global issue and really bring this to the forefront. So human trafficking is it's a vicious crime. It's basically modern slavery, and it is a persistent public health concern across the globe. It's a multi-billion-dollar industry. They say that there's around 15,000 to 18,000 victims annually. However, we do believe that these numbers are not accurately represented, as it is definitely underreported. There are no specific trends as far as race, demographic, social class, and gender. While it is predominantly most human trafficking victims are women and children, men are not excluded, and men are also trafficked for labor exploitation and other abusive practices. So human trafficking is not limited to sex trafficking. We see human trafficking in child soldiers, forced labor, buying and selling of organs, domestic servitude within the house. They hire, well, they don't really hire, but it's almost like domestic slavery where they do chores within the home, human trafficking of athletes, and even debt bondage where people get into debt by borrowing money and then they become they get forced to do forced labor in order to pay back those debts. So that's just some of the examples of how human trafficking transcends more than just the sexual market. So we do know that while human trafficking can be really hard to distinguish and discern, because they're very discreet and in their practices, but we do know that they have been known to seek medical care, and healthcare providers, especially emergency providers, those ED nurses and ED providers, are one of the few nursing professionals or medical professionals most likely to come in contact with a human trafficking victim. So we know that human trafficking, they're subjected to sexual, physical, and psychological abuse, and human traffickers are very much motivated by greed and driven by quota. Some popular businesses and services will use human trafficking as a front. For example, nail salons, door-to-door sales, the food industry will use human trafficking victims in these platforms. Now, I'm not saying that they're not all nail salons are, doing this. So there are legitimate businesses with ethical practices, but it has been shown in research that some of them use these storefronts or these services as a way to kind of, hide their practices as a front. So I will pass it over to Dr. Giancaterino, and she'll talk about the role of the nurse educator and frontline nurses.
Okay, thank you, Dr. Lopez. So some of the things that we want to highlight based on all of this background information that Dr. Lopez shared is that we have found that a lot of our patients, our clients coming through, are really impacted by their background, whether they were kidnapped, whether this is happening with their own family members, or exploited through whatever their environment and their situation is. And so when we look at the nurse, it's very important that we look at how they are being assessed and admitted. And so we want to make sure that we share some of the evidence that's showing, when we look at the emergency department, whether we look at pediatrics, labor and delivery, is there an assessment going on in the clinical setting? Do you have an admission process where you are training nurses and making sure that they're aware of the signs and symptoms of a possible trafficking situation? And so some of the things that we have here on the screen are that the client typically has no money, they're not able to speak for themselves, someone's speaking over them, signs of abuse, neglect, story just doesn't quite make sense, very frightened, anxious, and we just see this with our domestic violence clients as well. So there's a great, similarity with this. Sometimes when they're unable to give their full name or their address, it definitely are some big red flags. And really ensuring that we're approaching these clients appropriate related to culture, religion, age, And a lot of times it's that awkward questioning of these clients to make sure that we're treating them with respect and trying to get this information from them. So we make sure that they feel comfortable enough to hopefully share it with us. And so one of the things we know at the hospital where I'm at, we have the little cards that sit inside the bathroom doors that say, are you at risk? Are you potentially being abused or trafficked at this time? And so hoping that they will grab the card, discreetly put it in their hand, bring it back and possibly make a phone call for them by themselves or admit to us while we do a screening. And just to transition over into the nurse educator role, which is obviously a repeat of all of the things that we just spoke about that we'd want to teach our students. One thing that we really worked on was looking at where in our curriculum are we covering this information? We had to look at everything from our beginning courses all the way to our senior year 3, year 4. And we found that it wasn't being covered, or it was kind of looked at as, oh, that's somebody else's course. Somebody else will cover that information, or that's only pediatrics, and not realizing, obviously, yes, the average age is 13. However, this could be adults as well. And so one specific area that we added was in our OB simulation. So as our normal vaginal delivery simulation, we made sure that the admission questions, we created a human trafficking assessment, a few questions, and tried to teach the students how to ask those questions when it comes to approaching the client and saying, I have some difficult questions I'd like to ask you about, looking at who's in the room with them, and helping the students realize that this is such an important thing that they practice and will participate in when they become nurses. So we very specifically added an activity into our simulation, but the idea that it could be practiced in med-surg, it could be done in pediatrics, and then of course we want it repeated at the end of the program. So working together with our colleagues across the entire curriculum to make sure, where do we introduce it, where do we reinforce it, and then of course preparing our seniors to make sure that they feel comfortable with the information. So we are at our minute mark. I'm going to just look in the comments right now. There's a note to Dr. Lopez saying thank you. It is such a devastating challenge, absolutely. Yes, and thank you. A lot of states are requiring mandatory education for our hours and maintaining our licenses, which we are so appreciative that this is becoming a standard in our nursing world. And then great in a community simulation, perfect. And that's it. There's no one right spot. It's just, are you doing it? And the fact that we don't rely on any one faculty to do it themselves, but that we have a structured, whether it be outline or script, or as I mentioned, we do it in a simulation. So we know that every single student will get this information. We knew that we had to make it very detailed for our staff and to make sure it's written. So especially as we work with different boards of nursing, because we have campuses across the country, that we are complying with, majority of them are specifically listing this out as a requirement during their programs. So for us to teach in their state. So, we feel like we're very actively doing that and continuing to grow in how we're covering this information. Any other questions? Dr. Lopez, any other final thoughts?
No, Florida, I just thank you for your comments, everyone. Florida is definitely a hotbed for human trafficking, and most major cities in the United States are. A little Google search will take you a long way to show you what exactly is going on in your backyard. So we do need to let our students we do need to teach them, let them know what is going on in the backyard, and that they probably will come in to contact with these victims, and they need to be really astute and use their critical thinking skills to be able to pick up on some of these clues, because most of the time these victims are just scared to say anything, even to nurses, and they know we're here to help them. So the fear is just so overwhelming. So yes, thank you everyone for your time and attention today.